studies that have looked at those that have had measles versus those that don't find that those that have had measles have a statistically significant greater reduction in deaths from cardiovascular disease and various cancers. So I'll give you an example. There's a 22-year prospective study in Japan funded by the government of Japan and major universities that tracked 100,000 people in Japan for 22 years. And it found that those that had measles and mumps had a 20% statistically significant decline in deaths from cardiovascular disease. Think about that for a second. Just think about that. About 800,000 Americans die of cardiovascular disease. If eliminating measles and mumps has increased cardiovascular deaths in the United States by even 1% on a life years lost basis, you are still way upside down on your public health benefit by eliminating measles.
Can I ask you what the speculation is, how that could be? Why would measles and mumps infection at an early age improve your health cardiovascularly?
Why would it also, those that have not had measles have a 66% increased rate of non-Hodgkin lymphoma and 266% increased rate of Hodgkin's lymphoma, which kills 20,000 people a year? Why would women that have had measles have 50% less ovarian cancer, which kills a lot of women every year? What is it about it? Maybe, and here's the thing, and you can have evolutionary biologists talk about this as well. You've had some on. Think about it this way. Pathogens have come and gone throughout the ages, right?
Right.
This one didn't. Measles, mumps, rubella, chickenpox, they didn't. It could be, maybe, I'm not saying it is, I'm just saying this is what the data appears to reflect. What I just told you about with cardiovascular disease and cancer, they're all in PubMed. They're all PubMed studies. They're all in the published literature, and they're all consistent having the findings that I just described. Okay, I'm just a lawyer. I'm just repeating to you what the data reflects. It could be that having those febrile childhood infections conferred a survival advantage overall. And it could be the reason they never actually went away over time, became less obviously pathogenic.
So it has like a hormetic effect, and it makes you physically stronger somehow or another. It makes your immune system stronger, your cardiovascular, like a stress test. That means it's not outside the realm of possibility, right? I mean, if lifting weights makes you stronger and, studying makes you smarter, would it make sense that some form of infection that you recover from will make you more resilient? It does make sense.